Some people are mixing Pepcid and Allegra, saying it helps with their depression, anxiety, and even premenstrual symptoms. But is this safe? Well, we are fact-checking this for you. Dr. Bijoor joins us now from Oakview Medical Associates. So thank you so much for being here today.
Thank you for having me, Kari.
So let's first start to understand the science of what's going on here and why this might be anecdotally helping some people feel better. What is happening?
So the latest trend on TikTok claims that Pepcid and Allegra, which are two histamine blockers, can help treat depression. So let's break down the science if there is any. Pepcid is a H2 histamine blocker, which basically blocks stomach acid production and helps GERD and acid reflux. And the Allegra is an H1 blocker, blocks histamine type 1 receptor, and that helps block allergy symptoms like sneezing, runny nose, itching, hives, and such. So both of these, we know that they block histamine, which is a chemical mediator of inflammation. So for example, if you're exposed to pollen, you're going to start sneezing and itchy, and these medicines will block that. Now, whether they really help depression or mood remains to be seen. There is some evidence that histamine does increase inflammation. It does cause some gut inflammation and possibly helps with brain signaling. So I think that's where this is coming from.
So do you think the inflammation could be coming down? I know anecdotally maybe some of these people don't realize they have allergies. So do you think something could be going on there as well?
I think it's multifold. I think, allergy symptoms, it make you very moody and irritable. So by blocking that, it probably gives you some relief. Some of our older generation antihistamines like Benadryl, diphenhydramine, or Dramamine, people get that over the counter just when they're feeling nauseated and irritable and motion sick, because they do block the inner ear imbalance. So they're used for vertigo and motion sickness. So I think there is a benefit of using centrally acting medications to block that. But the correct treatment for depression and premenstrual dysphoric disorder, or PMS, is taking the serotonin boosters, lifestyle medicine, dopamine receptor agonists. So those are the correct treatments for depression.
Because these treatments don't actually increase the serotonin like the SSRIs.
They do not. They're not neurotransmitters. They just will block the mediator of inflammation, so they help you feel better. There is some placebo effect, which is real, and it's not made up. People do feel better. Possibly by blocking the histamine, you can have better sleep, because some of them do cause sedation, so maybe they have a calming effect.
Now, I understand that certain foods have histamine in them as well.
Right.
And what are those, and should you avoid those if you either have allergies or maybe you're kind of getting on this trend?
Yeah, so aged cheese, fermented foods, some wines, and also tomatoes can cause headaches, stomach ache, anxiety, irritability. So by blocking that, possibly, can have some benefit.
So maybe just reduce those foods a little bit.
Reduce those foods, yes.
The bottom line, are there any risks if you mix Pepcid and Allegra?
So in family medicine, we treat a lot of depression, and a lot of our patients that are on antidepressants are also taking Pepcid for reflux and also taking Allegra or Claritin for allergies. So we know that people are taking them simultaneously without any, major adverse effects. But, whether they are directly antidepressants, I don't think so. There is some emerging evidence that histamine is released along with estrogen levels premenstrually. So maybe that's where they're, having a calming effect in the premenstrual, because I think that's what TikTok showed, a lot of women getting some good relief in that,
Yeah, okay. Well, definitely talk with your doctor and use some caution.
Absolutely. I think that's number one. Social media sparks curiosity, but then seek your physician's care to really evaluate your symptoms.
All right. Thank you, Dr. Bijoor, for all of that.
You're welcome.